Welcome to our staff members. In this training video, we are concentrating on the updated training guidance when dealing with COVID-19. Staff guidance on dealing with COVID-19 is regularly updated as we receive the latest information from the World Health Organisation, Public Health Wales and the Welsh Government. Please watch the video until the end, and it is important to refer to our detailed document, COVID-19 Staff Guidance Number 2. Hand washing. Regular hand washing is part of our standard infection control procedures. Wash hands thoroughly and frequently for a minimum of 20 seconds with soap and water. Always wash hands upon entering and leaving the premises. Wash hands regularly with soap and warm water and in between attending to personal care, regardless of the use of gloves. We recommend the World Health Organisation's video on hand washing, which is probably the best demonstration of safe hand washing technique. Sanitize hands thoroughly using hand sanitizer or alcohol in between hand washes or when washing is not possible. Be mindful that alcohol and hand sanitizers are in very short supply. However, using sanitizers is not a substitute for regular hand washing for a minimum of 20 seconds. Social distancing is vital in keeping the virus at bay. This includes avoiding handshakes or hugs and keeping 2 meters apart where possible. When delivering personal care, staff should wear personal protective equipment as an alternative to social distancing. Personal protective equipment, when to use. Proper use of PPE is essential when delivering care. This is to protect each resident, yourself and your colleagues. Standard PPE should be worn for non-symptomatic residents. This includes our standard gloves and apron as well as face masks. You can retain the same face mask throughout the shift. This is for sessional use for non-symptomatic residents. Enhanced PPE should be used for symptomatic or confirmed cases of COVID-19. This includes face masks, goggles or face shield, as well as your usual apron and gloves. How and when to dispose of PPE. Standard PPE for non-symptomatic residents. You should dispose of gloves and apron after each resident as usual. Masks can be retained throughout the shift for sessional use. Enhanced PPE. Symptomatic or confirmed cases of COVID-19. You must dispose of gloves and apron after each resident as normal. You must dispose of your masks after each resident. You can retain your goggles or face shield, which must be washed or sanitized for reuse. All PPE should be disposed of as clinical waste in yellow bags. If dealing with confirmed cases of COVID-19, PPE should be removed immediately, placed in the designated bin near the laundry. PPE and clinical waste involved in the care of non-symptomatic residents should be disposed of in the usual way via yellow bags in each bathroom. PPE and clinical waste derived from suspected and confirmed cases of COVID-19 should be removed immediately and disposed of in bins located near the laundry. This is because waste can remain infectious for up to 72 hours. Therefore, waste and soiled linen should only be transferred to the yellow bin in the bin store area at the end of every evening shift on Mondays and Fridays. This will allow 72 hours containment before collection by the external contractor.
Perfect.
The care home continues to be placed in lockdown with only essential visitors attending. If there is a need for a resident to be assessed by a healthcare professional, such as a GP or nurse, The staff should grade the severity of the illness and, if possible, seek to conduct an assessment via telephone contact. Staff should take clinical observations such as blood pressure, temperature, pulse and respiratory rate, which will assist the practitioner with their assessment. Where face-to-face assessment is warranted, this should be done as a last resort. Staff must ask these visitors to sanitize their hands on entering and leaving the building and wear footwear protectors. All deliveries should be conducted via the admin office or placed in the plastic grip bin receptor. When permitting a healthcare professional visitor, it is important that the staff keep corridors clear and avoid unnecessary contact with other residents and staff. Hospital admissions should be discouraged where possible. Staff should discuss this with the GP, paramedics or ambulance staff to see if a referral can be avoided. If in doubt, staff should refer to the resident's anticipatory care plan and consult with the manager or person on call. If a hospital admission is unavoidable, upon the return of the resident, they should be isolated for close monitoring and twice daily temperature checks for 7 days. The same principles apply for the use of PPE for our domestic staff. Domestic staff should be fully informed of the COVID status of each resident, whether they are non-symptomatic, symptomatic, suspected or confirmed cases. For general cleaning of the care home, standard PPE applies. This is the use of apron, gloves and masks. When dealing with chemicals, including sanitizing door handles, masks and goggles must also be worn. When cleaning areas with isolation cases or COVID-19 areas, domestic staff should use full enhanced PPE, including apron, gloves, face masks and face shield. The same restrictions apply as to the disposable and reuse of faceware. Availability of PPE. Gloves and aprons are made available in the usual areas around the care home. Masks, goggles and face shields are made available via the medication room. Staff must complete the allocation schedule upon collection. Reusable goggles and face shields are to be stored in individually labelled containers in the designated area. The same principles of PPE apply to our laundry personnel. Laundry from suspected or confirmed cases of COVID-19, if unsoiled, can be washed with general laundry. Soiled clothing, such as with bodily fluids like vomit, sputum or diarrhea, should not be washed and must be disposed of in clinical waste. Absence notification requirement. Staff should inform the care home's responsible individual in writing via email and not come to work if they have symptoms of COVID-19, which include a high temperature, a new continuous cough and/or breathing difficulties. Staff should seek medical advice via their GP and by calling 111. Members of staff experiencing symptoms must self-isolate for 7 days. After 7 days, if there is no high temperature, there is no need to self-isolate, and we will advise you when to return to work after completing self-certification. If a high temperature continues, staff must self-isolate until the temperature returns to normal. Coughing can last for several weeks after the infection has cleared, therefore it does not require continuation of self-isolation after the 7-day period. Household occupants. If someone in your household has symptoms, staff must self-isolate for 14 days. If you get symptoms within the 14-day period, you must self-isolate for a further 7 days. If no symptoms are present, you can return to work after 14 days of self-isolation. The home staff absence rules and regulations must also be followed, and the staff must contact the manager by phone to arrange a return to work interview. COVID-19 testing. The responsible individual may require you to attend a test centre for COVID-19 testing. Staff are required to notify the responsible individual by email the date of their test, when it was undertaken, and on receiving their result. Staff must also notify the RI by email if someone in the household has symptoms, is in self-isolation, or has tested positive for COVID-19. You have a duty of candour to notify the responsible individual and/or the manager if you suspect a resident colleague or anyone in your household is self-isolating or is tested positive for COVID-19. Hygiene special measures. All door handles, knobs and push plates around the care home, as well as other identified surfaces, must be sanitised using the V500 bactericidal or other approved cleaning solutions at the below following times. A nominated member of staff does this on each shift. Light switches and keypads are sanitised once daily in the morning at midday. The nominated person should be aware of the cost information, dilution rates and contact time for the application to be effective. Resident well-being. During this unprecedented time, staff must be extra vigilant in monitoring residents' mental state due to the lockdown requirements. If you notice a resident's mood is adversely affected, please report this to the manager or staff in charge. At this time, carers are encouraged to spend more one-to-one time with residents to offer support and mental stimulation. Staff should observe residents closely and report any symptoms to the manager or person in charge. Staff should also encourage residents and their families to remain in contact via telephone or Skype or Zoom video calls. Support for staff. Directors extend their sincere thanks and appreciation to all of our staff members for their hard work during this difficult time, and encourage them to continue to be flexible with their working hours. The uncertainty of when the virus will strike our doorstep is affecting us all, and we must be vigilant and follow guidance to keep our residents and staff safe. We encourage our staff to seek support and guidance from senior management should they find they are struggling in any way. Emotional and financial support can be made available to individuals needing it. Stay safe and help our residents stay safe and well. Thank you.